and welcome to today's COVID-19 update, where we'll be speaking to the Minister of Health, the Honourable Dr. Frank Anthony.
Dr. Anthony says the Infectious Diseases Hospital at Lilliendale now boasts a labour room where pregnant women infected with COVID-19 can give birth.
And we have 22 persons who are pregnant, but they're also COVID positive. And those persons right now, we're keeping them at the COVID hospital, and when they go into labor, we sometimes move them over to the Georgetown Hospital to give birth. We have recently set up a labor room at the Ocean View Hospital, so persons can deliver there as well. And we have added operations theater, so if we need to do emergency cesarean section, that we'll be able to do that at the Ocean View Hospital.
The Health Minister also noted that to protect against the virus, expectant mothers are encouraged to get vaccinated.
Unfortunately, there's still a large group of women who, for whatever reason, are not taking the vaccine, and that would result in them getting sick, because during pregnancy your immune response is a bit depressed, and therefore it is absolutely essential that you should get the COVID vaccine, which would protect you from COVID-19. As you can see from today's numbers alone, having 22 persons in the hospital who are pregnant and with COVID, that's quite a high number. This can be avoided, or they would have a more milder form of the disease if they were vaccinated. At this point, you can be vaccinated in any one of the trimester, whether it's first, second, or third. It doesn't matter, but you need to be vaccinated. We have had meetings with the obstetricians, and we have spoken to them. We have sent out guidelines to all the doctors who are caring for pregnant women. And we have shown them the consensus that has emerged around the globe from very stringent authorities pertaining to why women should get vaccinated during pregnancy. So all of this we have been doing, and hopefully we can get those numbers up. But I think there are persons who still believe that if they take the vaccine, that something would happen to their child. Millions of women around the world have taken this vaccine, and there's no adverse effect taking the vaccine, neither on the mother nor the child.
Here is an update on the country's current COVID-19 vaccination status.
So as of yesterday, we've had 398,281 persons who would have received a COVID-19 vaccine. That now accounts for about 77.6% of the adult population. In terms of second dose, we had so far 273,880 persons who would have received a second dose vaccine. That's now 53.4% of our adult population. For the persons 12 to 17, first dose is now at 28,930. That's 39.7% of that age cohort. And second dose is at 20,112. That's 27.6% of that age cohort.
The Health Minister further noted that there seems to be a lag in vaccine uptake and urged persons to get their jabs.
Again, I just want to appeal to people, because if you don't complete what is called the primary series, meaning if it's a 2-dose vaccine, if you don't complete that series, then you're not going to be fully vaccinated. If you're only partially vaccinated, then you can get the severe form of COVID. So the vaccine would not be able to protect you, because your system would not be primed enough to fight off the virus. So everyone who would have received a first dose, we are appealing to them to make sure that they come and get their second dose. All the vaccines that we need to give second dose with, we have them in country, and therefore we want people to make sure that they put themselves in order and get that second dose. Then, as we have said, we have started this week the booster doses, and these are for people 50 years and older. So if you're 50 years and older, and your last dose, so the second dose was 6 months ago, then you can get your booster dose. So you need to come into one of the vaccination sites and get your booster dose, because we have seen that at 6 months, with most of these vaccines, that the immunity that you would have developed starts to wane. And if the immunity wanes and get to a very low point, then your chances of getting severe infection goes up. So just to protect yourself, make sure that you get that booster dose. And then we are also administering booster doses for persons 18 years and older, so between 18 and 50. If you have any comorbidities, you can make sure that you come out and get that booster dose. If you're working in a situation where you are in contact or can be in contact or at risk of COVID-19, then you can also get a booster dose. So booster doses are available now, and we really want people to make sure that if they feel they're at risk, to ensure that they get these booster doses.
That's it for today's COVID-19 update. For more information, visit our website dpi.gov.gy or health.gov.gy and our social media platforms.